Senator Kaine.
Thank you, Mr. Chair. Dr. Califf, in your verbal presentation at the beginning of this hearing, you concluded by saying, you know, there's some challenges if the U.S. were able to do things that other nations do in the area of ultra-processed foods, either because they have a different legal climate or they have different views about individual freedoms, then we might have more success in battling this. And I was intrigued by that, though that was not the questions I was going to ask you, but since you were referring to some things that other nations do, I thought I would just ask you, what are some strategies that are being pursued by other nations that are successful?
Yeah, so I actually think this is, for so much of the things that have frustrated me at the FDA, this is the core issue. We have a unique stubbornness of individualism in the U.S., which is phenomenally great in many ways. But when it comes to public health, it's a real problem because other countries know that we're interdependent when it comes to public health. That is, if you present, and I'll just use my experience at Google where I worked.
But I really want to get to specifics too.
Okay, so yeah, so here's the example. If you want to influence someone's behavior to eat healthy food, you don't present them with a chart with a bunch of numbers on it. You show them a picture of a graphic image that has an emotional impact. That's what the advertising on the other side is doing. Fruit Loops does not show commercials of one Fruit Loop with all the constituents of the Fruit Loop. It shows beautiful pictures of Fruit Loops and nice people eating them with an emotional impact. We're not allowed to do that, and even in some of our more recent dealings, we have been instructed that at the FDA, we just provide information. The one case that's an exception was tobacco, where we were instructed to do it, and we still lost in court the first time. It set us back 5 years. And so much of this has to do with the environment that people are living in. I mentioned I am Colorado prone because of my family. People in Colorado are not as obese as the rest of the country, and they exercise more. So if you're in that environment, you're going to be more likely to behave that way.
Have other nations already embraced front of package labeling of the
Absolutely.
way that FDA is trying
and
to
not
do?
just labeling, but warning signs.
Yeah, warning signs. How about, here's one that I know is controversial, but I've heard arguments on both sides. How about programs like SNAP benefits? A lot of SNAP benefits are used for very unhealthy foods. Do other nations that have supplemental food programs like SNAP benefits?
I can't honestly say I know about the other, exactly what the other nations do here, but I know that this is a USDA program, as you well know. It's vitally important. We have so many children in the U.S. who can't afford their own, their parents can't afford their own diet. And I know there was a battle over this issue last time around. It would be one of the most important things I think that could be done. Here, the U.S. government has the purchasing power. So why not purchase healthy food?
There are programs that do incentives for the purchase of healthy foods, but there's also some evidence to suggest that even in the same neighborhood, families that use SNAP benefits versus those who don't, the SNAP benefit purchases are generally less healthy than those who don't use SNAP benefits.
Again, and I hope I get asked about the weight loss drugs. I know we need to move on here.
All right, I'm going to ask you about that since I have a minute 21 left.
Okay. What's going on here is that the food industry has figured out that there's a combination of sweet, carbohydrate, and salt that goes to our brains and is very, I think it's addictive. Now, that's my opinion. And I think it's the same neural circuits that are involved in opioid addiction and other kinds of addiction that we have. And they've studied this. Again, we don't have access to their research data like we do in the human medical products arena. And so if you're a person without much financial means and you're walking into a grocery store and the inexpensive ultra-processed food is half the cost of the fruits and vegetables, and it's carefully configured to really hit that brain. The way to think about this, have you ever tried to eat one potato chip? It's almost impossible. So there's a reason for this. And there's a lot more research that needs to be done because we couldn't uncover the addiction circuits until the GLP-1s came along, because what they're doing is actually interfering with this circuit between the gut and the brain that tells you eat more. And there are actually 3 or 4 pathways involved here that are really fascinating that we're going to learn a lot more about. But here's a way to think about it. The food is probably addictive. And,
And
again,
engineered to be addictive.
this is not an FDA policy. This is my opinion, having looked at it.
Thank you. Thanks, Mr. Chair.
Let me just take a moment before Senator Braun goes. You just said the most important point of the hearing. You said that the food industry is producing products which are unhealthy and addictive. And the question, of course, is that's exactly what's going on. What the hell have we done about it over the last 15 years? Senator Braun.